Thank you.
His Excellency, thank you. Thank you for giving us this opportunity.
His Excellency, thank you so profusely for having us this audience. This is a team that is composed of three groups: Architecture for Humanity, Global Healing, and also Rotary International. They're here on a joint mission in support of what you have actually put together as a policy position, the Agenda for Change, concretely wanting to see how they can complement and leverage support in the implementation of the item 4, the free healthcare, the social service delivery on the health sector. This came about, just to give you the genesis of this meeting, in September, when you attended the UN General Assembly, at the end of which I traveled to Washington. There was a training organized by RAN Cooperation, which is the First Lady's initiative. And a few African countries were selected, among which was Sierra Leone, based on the work of Excellency, the First Lady, complementing your agenda, and how best some person from our team, our office, could be trained in executive management and policy analysis. At the end of that training, which was a one-week training, and the construct of the training was just about 10 countries, just to give you an insight. Sierra Leone was among those 10 countries. And I represented Sierra Leone in that training. And ensuing that training, there was a fundraising panel, which brought together private funders. Want to see, okay, we've trained, but how can we support concretely what these First Ladies are doing? Office of First Ladies are not operational in Africa. We're just trying to institutionalize them to complement their husband. Formerly, it was just a decorum following the husband, the entourage, but how best they can be programmatic in approach. So that was what the RAN initiative was all about. Now, when we had the training, we had private funders, and one of them is Mr. Luke Sorenson. He was Lee Christian Sorenson. He is actually the liaison for the Rotary International, and he, with his deep interest, from what he saw, the paper he read, the deliberation, and my presentation, said, Grass, we need to work substantively, concretely, in pushing the agenda of your president that the wife is complementing under the WISH framework. And so, under his leadership, he actually brought together all the dynamic forces, namely Global Healing, and on my right is Mr. Luke Ifland, and he's the president of Global Healing. And Global Healing is coming with two other people on board, and I would like Luke to quickly just introduce them.
This is Liz Donegan. She is one of our technical consultants. And she is currently an anesthesiologist, professor of anesthesia at the University of California in San Francisco, and is also trained in tropical medicine and clinical and anatomical pathology. Our other technical consultant is Ron Newton. He's volunteered at all of our project sites in a variety of capacities, both in blood banking and biomedical engineering.
And the team, as I said, His Excellency, Mr. President, is a three-component team: Global Healing, Rotary International, Mr. Lee Sorenson, who is an entrepreneur and a businessman, has actually established a lot of healthcare initiatives across America, and he wants to also see how we can leverage his support free of charge to this country. Kathleen West, she's actually representing Architecture for Humanity. And Architecture for Humanity actually has to do with building back Waiting Home and Women Resource Center, which is going to be a referral center to the main hospitals in our district. Like you have Bow Hospital in the community at a far fetch to see how the free healthcare is substantively delivered. We need to see how these people also have medical services. And the Women Resource Center and Back Waiting Home will be a referral system constructed that at least people within that vicinity will be able to also have medical services delivered to them. This initiative, as I said on the onset, Mr. President, came about from RAN, and she's going to implement that. She's the main coordinator, but I'll let them, as we proceed, a short meeting for her to go into detail. She'd lived in Sierra Leone before. That's the interesting thing of our history. She'd been where we want to go, Matru, for project feasibility, but that's going to be our project operational area for a start pilot testing. They're going to visit Connaught, Cottage Hospital, we're going to Bow, we're also going to Matru. The First Lady is going to accompany us. The Ministry of Health and Sanitation is going to also be with us. And tomorrow we're going to get an interagency meeting, which I've coordinated, to see how they can interact, learn from what the mistakes are, and how they can actually move ahead in implementing their project. With me here, Mr. President, if you'll allow me, I also have members of the office accompany us. Mr. Sam Bangura, he's the advisor to the First Lady. Mr. Lokobi Johnson, he's press secretary. Ms. Rubia Tubangura, she's a program coordinator, program officer, rather, for the WISH. And the lady down there, she's Island West. You know, First Lady has two program framework. One is on education, and the other one is on health. And the education has to do with the flaxes, the First Lady's attitudinal change in school, which of course comes under your overarching policy on attitudinal and behavioral changes. She is principally the coordinator. And myself, of course, the second time to you, His Excellency Gracias, I'm the head of operations and program in the office. Now, the beauty of this entire outcome is that to see once we come on board to help, which was my commitment when I first met you, what can I bring? What can I lend? It's not just to come and be with the First Lady, be around the President, but attract donor support and work closely with them to see what are lapses, what are gaps, and how they can come and help what you've already set as a policy. That's what the move is. You're the leader, and we're working around you to complement your effort. Thank you very much, Mr. President. And at this stage, I would give them the time to go into detail the level of support they intend to leverage. As I said, it's a project, a joint mission that comprises of three components: global healing, architecture for humanity, and Rotary International. And I would like Mr. Lee Sorenson, firstly, to talk about what Rotary intend to do in Sierra Leone and how they see interfacing with the national chapter of Rotary and the Canadian and US chapter. Thank you, Mr. President.
Thank you. Thank you, Your Excellency. It's an honor to meet you, absolute honor, and I'm pleased to be here. When I got involved with the First Lady's initiative and the fellowship, I was thrilled to be involved with that because of what I believe can occur through effective leadership in the country. And I believe your office and Mrs. Koroma's office should be congratulated on what they're doing. I supported the initiative as a donor because I wanted to see that happen. I'm friends with many Rotarians, one who's a trustee, Mr. Stephen Brown, who's a trustee of Rotary. So they've been very interested in supporting this project. So I am going to be working as a liaison with the clubs there, with Rotary International. They also sent Mrs. Koroma a letter, First Lady Koroma a letter thanking her for her effort in polio, in eradicating polio from the Polio Plus program. So I will be going back, reporting on this trip, working with local clubs, working with clubs there, and then also reaching out to not just local clubs, but clubs in Canada, possibly Japan, to support equipment needs and support whatever other efforts can be done in Matru and elsewhere. So that will be my and then I'll also be convening other possible supporters.
And I would also like the President of Global Healing to also kindly delineate the use of having the audience with His Excellency the President and the mission objective. Thank you.
Well, thank you so much for the opportunity, Your Excellency. I really appreciate you taking the time out of your day to meet with us. I'd also like to thank you for you setting up these initiatives for the people of Sierra Leone. I think you've well identified these immediate focus areas to reconstruct the country. I was kind of brought on by Lee Sorenson and Kathleen West to the First Lady's Fellowship, looking broadly at the WISH initiative developed by Mrs. Koroma, and kind of trying to find the synergies between global healing, what our capabilities are, and identifying the local needs here. And obviously with Matru Jong is the immediate site that we're looking at to bring in our institutional capacity within pediatrics and under 5 populations, neonatology, as well as blood banking and biomedical engineering. We have kind of done similar projects in different areas around the world, in Eastern Europe, Caribbean and Latin America, and are now looking to leverage those, if not in Matru, then potentially in Bo or Freetown. So again, I thank you very much for taking the time to meet with us today.
Thank you very much, Luke Ifland. Thanks so very much for pushing this agenda. We also have architecture for humanity, while Global Healing is actually on training and providing technical support in hospitals to also upgrade and modernize the free healthcare initiative and the service delivery, most importantly. Architect for Humanity will actually go into construction. Global Healing will not go into construction. They will give technical support in terms of materials and training, expertise and sharing of knowledge. Architecture for Humanity will complement by constructing, coming into the proper construct of centers. And I'd like our able Dr. Kathleen Mary West, to kindly define in detail what you are here for and how you will proceed with this mission.
Thank you, Chris. Thank you, Mr. President, for having us here. It's been a special pleasure for me to come back. I was actually at Fort Bay at the same time that you were a student there. I was in the oceanography program at the time, and I was here in the late 70s and then again in the late 80s, but it's been a long time since I've been here, so it's exciting to be back. And your turnaround is the reason that I'm really here, is that I'm excited to be able to re-engage with your administration. And so I've been involved, I'm actually a health professional, but I've been involved with the First Lady's Initiative, which is where we met grass in September. And my main interest was really in not just the general First Ladies on the continent, the other 10 countries that were there, but in Sierra Leone in particular. So I volunteered to help work, operationalize Mrs. Koroma's WISH initiative here, specifically in Matru, which I think is a brilliant place to locate some of the first outreach, and just, as she ably described, to consolidate the piece, which is really exciting. So I'm here really to represent Architecture for Humanity, do a site evaluation there, see how we can finish the renovation of the Montreal Hospital, and really explore a bigger vision for bringing many partners into the Montreal area to make it a real center of excellence that can be replicated nationwide, and to see how we can, first of all, improve maternal and child health so that that is a country off the ground, but then also to address some of the main issues around mental health as a fundamental piece in all of primary care, which I think is very fundamental in a post-conflict time. So I'm very honored to be here. We are going to be bringing as many partners as we can together to make sure that this first site gets off the ground, is done in a template that can be replicable across the country. And I think it fits beautifully with the rest of your entire agenda of the transformation of all the economy and the infrastructure that's needed. So we're very honored to be here. I sincerely appreciate your welcome. Thank you.
Thank you very much, Dr. West. Just to complement what she is saying, that we go into Matru, but the Pathway to the Home and Women Resource Center will not be constructed in Matru Chunk. It will be constructed 7 miles from Matru Chunk, and that's why Luke is going to see what are the facilities needed, to upgrade the system in Matru. And they're also going to Connaughton Cottage. These are the big hospitals that actually Global Healing is looking at. Periphery type of health center. And she's going to take samples of the soil, because this is a project feasibility mission and site assessment in the domesticated. What I mean by that, Mr. President, is that we're going to use local force. We're going to use when they come, it's nicely complemented action. And lastly, to say, before Your Excellency, I give you to make your remark, it gives it the global facade, the national facade. When they go back, their report will define that the ambassador was present. They had a meeting with the President of the Republic, which is a high-level attention that they're actually receiving, and also the ERSG, who is the executive representative of the UN Secretary General. I met him, I spoke with him, and he has consented to come along. And so they will travel on flight, but I will go with them on road, together with some of my colleagues, so that they see what are the real constraints, how the countryside looks like, and some of the fine things that have been implemented in terms of the good road network that you've actually put in place, and to see how things are improving tremendously. On that note, Mr. President, I just want to read you a letter that comes from the co-director of this African fellowship program. It's the African Leadership Program. And as I said, this fellowship program is to see how they restructure the functioning of First Ladies in Africa, so that they can be very much more operational and have executive office running. And so I was trained in policy analysis and management of executive position, and that bring about to see how best the office can be much more dynamic in approach, not just coming around and moving around, but really be program oriented. She said this, and I would like to read this to you, Mr. President. They are all referring to the team that actually come, because before now, last week Friday, what we did at the office together with my colleagues was to bring the partners that are going to really meet to have what we call a pre-mission meeting. And she's addressed also that pre-mission meeting. He said, allow me to wish Global Healing, Architecture for Humanity, of the First Ladies Initiative and Rotary team, and our colleagues at USAID, UNICEF, UNFPA, referring to local partners, the IRC, MSF, IMC, that's the International Medical Corps, the US Mission, and others. Very productive meetings over the coming days. The task of providing adequate maternal and pediatric services to the Matru-Jong area will require input from many partners, and we look forward to exploring the feasibility with you. For over 2 years, our African First Ladies Initiative has had the honor of working with Her Excellency Mrs. Koroma. Mrs. Koroma's dedication and vision, as well as expertise in the areas of health and social issues, have provided valuable contributions, as we all as inspiration to our initiative. Thank you again for your time and feedback during this joint mission. You are in good hands with Mrs. Koroma, hardworking and talented staff, including Brand Fellow, Sir Ibrahim Agassi, which is myself. All the best, Cora. She signed off, and your approval for this, because what I see is the overarching national policy that we're supporting to implement, and therefore we have to let the top-down approach when we're going to people from the grassroots. They must know that we have a blessing from Mr. Professor. Thank you, sir. We are with you.
Thank you, President Director. Let me welcome all of you and to thank you on behalf of the government and the people of Sierra Leone for the support that you are providing to this great initiative we have taken in the country. We believe that it was a timely initiative, and the responses we are having by way of the uptakers of the free healthcare service is a clear indication that there was a great need for it that has not been addressed over the years. And because it was not addressed, we had terrible mortality indicators, and which we are now trying to address by taking this initiative that we have adopted. And by you coming, I think it's giving support to the implementation of this great program. And I believe that we need all of the support that we can receive from you, because we know that there are great challenges out there. But I think with a combination like this, I think is a welcome thing. We need a technical support, we need a structural support. We also need support from the Rotary International that we have been having. Rotary has been here over the years. I am a Rotarian myself. I've been in Rotary for quite a number of years, and I was accorded the Paul Harris Fellowship last year. But I do appreciate the efforts Rotary is contributing to national development, especially in the social service sector. And I want to thank you for collaborating with our local clubs and also sourcing support from the international clubs. Our free healthcare initiative is moving on. We believe that we are on the right path. This is not to say that we don't have challenges. There are great challenges. We still have to develop our capacity in terms of the service providers. We have to improve on the equipment that they use in providing the service. We have to increase the structures that we have around. The hospital structures are very limited in terms of relationship to the population. The EHUs that we have, and that is why I welcome this center that you are going to develop in Banagemo. I think it will be very, very appropriate, and it will provide the kind of service that is required within that community. But most importantly, I think support that will be given to Matru-Jong is quite unique, because it has been an old hospital, but run down over the years. There is now a great need for it to be improved, and it's having a great community within the area. I have been there myself during the wrapping up of preparing for the launching of the free healthcare on the 27th of April. And there there's still a lot of work to be done here. The operating rooms are still not in a good shape. Even a few of the wards need a lot of refurbishment, and the electricity provision and the wards, I believe, are inadequate. So there is still a lot to be done, and I think with support from all of you, we'll be able to improve on it, and not only make it showpiece, but be able to replicate it all over the country. So let me thank you for responding to this call that we have made. We have taken the initiative with the hope of having such a response, and it's coming very well. And we are happy that you are coming, especially in addressing all of the various sectors that need to be addressed. And I want to assure you of our commitment. We're going to move on with this project. We're going to ensure that the support that will be provided will get to the targeted group and will be utilized for the benefit of Sierra Leoneans, Sierra Leonean mothers, Sierra Leonean children, especially the under fives. And with the hope that we will improve considerably the terrible indicators that we are having, and also the health of the nation as a whole. Because it's only when a nation is healthy can it be guaranteed of a sustainable growth. It's only when our children health is addressed and taken care of can we be guaranteed of a future. So I think these are issues that we will continue to show great commitment, and we would like to come to give us help. It's appreciated. Let me welcome you, and I hope that you will have a pleasant trip to Matru, and you can see the side of the country, and I think you will have a better understanding of our needs, and I'm sure that this will be the beginning of an interaction that we hope will continue, so that we can together work as partners to lift Sierra Leone from where we are now. Thank you very much.
Thank you.